everyone, and welcome to this video on brucellosis, a bacterial disease that affects both animals and humans. I'm Dr. Yumna Kalani, and I'm going to talk to you about the etiology, mode of transmission, mode of infection, vectors, symptoms, prevention and control, treatment and diagnostic tests of the zoonotic infection. Brucellosis is caused by various species of bacteria belonging to the genus Brucella. These bacteria are small, intracellular and gram-negative. They mainly infect cattle, swine, goats, sheep and dogs, but can also affect other animals such as marine mammals and wildlife. The most common species that cause human brucellosis are Brucella melitensis, Brucella abortus, and Brucella sui. Humans can acquire brucellosis through direct contact with infected animals or their tissues, fluids, or excretions. This can happen when people work in the livestock sector or handle animal products such as meat, milk, or cheese. People can also get infected by eating or drinking contaminated animal products, especially unpasteurized dairy products from goats or sheep. Another way of transmission is by inhaling airborne agents that contain the bacteria, such as dust or aerosols. Human-to-human transmission is very rare. The bacteria enter the human body through mucous membranes or skin abrasions and then travel through the bloodstream to different organs and tissues. They can survive and multiply inside cells, especially in the reticuloendothelial system. The incubation period of brucellosis can vary from a few days to several months, depending on the dose and route of exposure. The symptoms of brucellosis are often nonspecific and can mimic other diseases. They include fever, chills, sweats, headache, fatigue, malaise, weight loss, muscle and joint pain, enlarged lymph nodes, spleen and liver. Some people may develop chronic or recurrent infections that affect the bones, joints, heart, nervous system or reproductive organs. Complications of brucellosis can be serious and life-threatening. The diagnosis of brucellosis is based on clinical signs and symptoms, history of exposure and laboratory tests. The most commonly used laboratory tests are serological tests that detect antibodies against Brucella in blood or other body fluids. However, these tests have limitations such as cross-reactions with other bacteria, false negatives in early stages of infection or false positives in vaccinated individuals. Other tests include culture of Brucella from blood or other specimens, molecular tests such as PCR that detect Brucella DNA or antigen tests that detect Brucella proteins. The treatment of brucellosis requires prolonged courses of antibiotics that can penetrate intracellularly and eradicate the bacteria. The choice of antibiotics depends on the type and severity of infection, the patient's age and condition, and the local resistance patterns. Usually, a combination of 2 or more antibiotics is recommended to prevent relapse and resistance. The most commonly used antibiotics are doxycycline, rifampin, streptomycin, and gentamicin. The duration of treatment can range from 6 weeks to 6 months or longer. The prevention and control of brucellosis is based on surveillance and elimination of infection in animals. Vaccination of cattle, goats, and sheep is recommended in areas where the disease is endemic or prevalent. Serological testing and culling of infected animals can also be effective in areas where the prevalence is low. In countries where eradication in animals is not feasible, prevention of human infection relies on raising awareness, food safety measures, occupational hygiene, and laboratory safety. Some preventive measures include avoiding direct contact with infected animals or their tissues, fluids, or excretions. Wearing protective gloves, masks, and clothing when handling animal products. Dispose.
Hi, my name is Adam and I have a story to share with you. It's about how I got brucellosis, a disease that you can get from animals or animal products that have bacteria called Brucella. I live in a village where we have many goats and sheep. One day, I noticed that some of them were sick. I tried to help them without wearing any gloves or mask. I did not know that they had brucellosis and that I could get it too. A few weeks later, I started to feel very bad. I had fever, chills, sweats, headache, fatigue, weight loss, and pain in my muscles and joints. My mother took me to the health center, and they told me that I had brucellosis. They said that brucellosis is a serious disease that can affect different parts of your body. They said that I needed to take antibiotics for a long time to kill the bacteria. They also said that brucellosis can be prevented by avoiding contact with infected animals or their products, by wearing protective gear when handling animal products, by cooking meat well, and by boiling or pasteurizing milk and cheese. I wish I had known all this before. I wish I had been more careful with our animals and their products. I wish I had gone to the doctor sooner. Now I have to suffer the consequences of my mistake. Please learn from my story and don't let brucellosis ruin your life. Brucellosis is a disease that you can avoid if you follow some simple steps. Remember, prevention is better than cure. And don't forget, if you love your animals, take care of them too. If you notice any signs of illness in them, call a veterinarian right away. They can help you diagnose and treat brucellosis in your animals before it spreads to you or others. Thank you for listening to my story. I hope it helps you understand more about brucellosis and how to prevent it.
Here is a possible set of 10 interactive questions to check for brucellosis infection. Have you had contact with animals or animal products in the past year? Yes or no? If yes, what kind of animals or animal products did you have contact with? Cattle, goats, sheep, dogs, marine mammals, wildlife, other. How did you have contact with them? Direct contact with blood, placenta, fetuses or uterine secretions, or handling or processing meat or dairy products, eating or drinking raw or unpasteurized animal products, inhaling dust or aerosols containing the bacteria or other. Have you traveled to a country where brucellosis is endemic or prevalent in the past year? Yes or no? If yes, which country did you travel to?
Have you had fever, chills, sweats, headache, fatigue, malaise or weight loss in the past year? Yes or no? If yes, how long did these symptoms last and how severe were they? Days, weeks, months, mild, moderate, severe. Have you had muscle or joint pain, enlarged lymph nodes, spleen or liver in the past year? Yes or no? If yes, which muscles or joints were affected and how severe was the pain? Neck, shoulders, elbows, wrists, hands, hips, knees, ankles, feet, lymph nodes, spleen, liver, mild, moderate, severe. Have you had any complications of brucellosis such as bone infection, arthritis, heart infection, nervous system infection or reproductive organ infection in the past year? Yes or no?